Hi everyone, Lynn Hero here, one half of the ST Sisters duo. Today we're going to be doing a live demonstration of the amazing HOP needle-free filler facial. And I'm going to give you some tips on some different modalities that you can use with this treatment. And then we're going to go ahead and jump in, give you some extra tips and tricks as well on how to make it easy and super successful for you and your clients. Okay, so first off, I've cleansed the skin of my client. And typically in the beginning of my facial with the needle-free filler facial, I love to do some kind of modality work. Because we now have cold plasma, whether it's the Dr. Platon or it's our Tonisure, it increases product penetration by up to 24% over the next 12 hours. This makes it ideal for use with the needle-free filler facial, which is all about penetrating the polylactic acid into the skin to stimulate collagen. So again, the needle-free filler facial, think of it as the ability to create collagen, to stimulate collagen volume in your client's skin without the use of needles. So the Koreans figured out about 12 years ago, TOV Medical, how to actually penetrate polylactic acid, which is the same ingredient that is in dissolvable sutures and in some biostimulating fillers. They figured out how to use a hydrogen mask to penetrate the polylactic acid into the skin. The results will last up to 6 weeks when done as standalone. And if you do in a series, the results can actually last for months. And that would be a series of doing 7 to 10 days apart. Typically, what I and Rachel like to do as well, though, is most of our clients, in addition to having significant volume loss and needing to work on plumping and stimulating collagen, is most of them are dealing with laxity, fine lines, wrinkles as well. So I love to alternate the needle-free filler facial with our Do a More V-line treatment 2 weeks apart, so that we're actually doing a needle-free filler facial once a month. And then on the opposite 2 weeks, we're doing that V-line. And then once our customers get to where they're happy with their skin, where they want to be, then we have them on maintenance monthly or every 6 weeks with the needle-free filler facial. That also then gets extended and magnified when they're using the HOP home care products, which all have the polylactic acid and growth factors in them as well. So for our demo today, we've cleansed our client's skin, and I've already done a full 10-minute treatment of the Dr. Platon on 5 minutes on each side of her face, including the neck area. Again, when you're doing the needle-free filler facial, you have some options. You can do full face and neck. If a client did not need any volume or didn't have a lot of fine lines and wrinkles, already had a lot of fullness in the neck, you can actually do the décolleté area, and you can actually do the hands as well with this treatment. So you have lots of versatility with the needle-free filler facial. So again, it's all about building volume, building collagen for the client. So our next step after we've completed the cold plasma portion, one of the devices modalities that we use with all of our needle-free filler facial treatments is our TimeMaster Pro. This is our ultrasound, 90,000 oscillations per second, combination of LED and electromuscle stimulation. It's now reformulated or redeveloped with level 1, has no electromuscle stimulation for clients that find that too sensitizing. And then we have level 2, 3, which increases incrementally the amount of electromuscle stimulation. And level 4 is pretty intense. So I would recommend probably starting at a level 2 or 3. And then as you work with clients over time, you can increase to the level 4. So we are going to do a 5-minute treatment on one side of the face. The device will turn off at that time, and then we'll complete another 5-minute here on this side of the face. The reason we choose this modality is because the ultrasound is really awesome at stimulating metabolism, increasing blood flow. It also does a great job of plumping the skin. And then again, with the electromuscle stimulation, does a nice lifting as well. So this makes it an ideal match for the needle-free filler facial. So I'm going to first prepare a cocktail to use. Whenever you're working with ultrasound, you always want to use some kind of a gel or serum that is water-based. So our device does come with the HOP Promoter Collagen Gel, and I'm going to put about a quarter size into a bowl, like so. And then just to give it a little extra oomph and slip, I love to add my Dr. SD ampules, and I've got a couple that I chose for my client today. So I have the MGF growth factor, which has 88% snail mucin. It's got peptides It has some goat milk and other growth factors as well. So this is just going to add a lot of extra moisture, wound healing capabilities. So I add a good half dropper of that. And then the other one I'd love to do and to add for hyperpigmentation issues is going to be the Dr. SD Vita C ampule, which actually has an alpha melite formula or complex to help suppress melanin. So it's got some nice tyrosinase inhibitors in there. So I'm going to use a nice half dropper of that. So next, what we're going to do is we are going to apply to half of the client's face. And the reason I do that is because we want to make sure that the product does not fully absorb into the face by the time I get to the other side of the face. So I am going to just mix this up. And then I'm going to start working with the neck area. And the purplish blue color that you see here is azulene, which is super great for irritated skin, sensitive skin, a lot of redness in the skin. So it's very calming and soothing. The collagen gel has the polylactic acid and the growth factors as well. So another benefit of using the ultrasound is that it helps to penetrate product as well. So now by using the cold plasma, whether it's the Tonisure or the Dr. Platon first, and a little bit of the ultrasound, you're again increasing product penetration. So that is going to make for a much better result. So turning on our device, the top one, we're going to hold in. That's going to activate our device. You have multiple colors. You can do a multi-flashing, which is the most intense. You can just do a red, a blue, a green, or none. When we go back to our multicolors, we are working with the infrared as well. So we're going to get a really nice added LED benefit for the skin. So I start with just a little bit of just kind of massaging or rolling around on the skin, little circular motion, just to help with the LED component. So I do about a 1 minute of this on the face, again, starting with the neck area. I do avoid the thyroid area there. And again, this is level 1, so there's no electromuscle stimulation. If the client seems okay with a little bit, you just ask the client, how do you feel with that? Feels good, just giving me the thumbs up. So I'm just going to start with the level 2 here, which again is our first level for electromuscle stimulation. So after I just do a little bit of these roundy circles, again, if a client has any implants or any dental implants or a lot of fillings, for example, metal, they're going to feel a little bit more sensitive. So either go down a level or just avoid that area. If you don't have the other ampules, you can use another water-based serum. You can also use your HOP stem cell mist, which we will be using in this facial treatment. So again, just as long as you have enough slip and it's water-based, you're good to go with working with ultrasound. Okay, so I'm kind of coming up on that minute up here. And again, your device is going to turn off at the 5-minute mark, so no reason to really time. I just find that doing a little series of these circular motions takes about a minute. Then I come down and I start what I call my sculpting and my lifting process. Okay, so we're going to continue with our sculpting, and this is going to take the remaining 4 minutes or so. So I would say do about 6 passes and then move up about a ½ an inch. I like to come along the neck here. Again, you want to always encourage lifting. So one little clever tip is that the face is the only place on the body where the skin is attached to muscle, or the muscles attached to the skin. So when you're working with any kind of electrical current, like your electromuscle stimulation or your microcurrent, when you're going up and you're using your modality, it's going to encourage the muscle to lift, and hence the skin will lift as well. So that's how you get your lifting from the treatment. So I love, again, combining this with my needle-free filler facial because it gives a plumping effect and also a really nice lifting at the same time. So this device in and of itself can be used a couple times a week. It can also be sold to clients for home care, for just the maintenance in between appointments as well. So a lot of flexibility. Then I work right under those cheeks, again, to encourage the lifting and the plumping there. And you will see a little bit of movement. This is just on the lowest level of the EMS, but you should still see a little bit of the muscle moving, and that's perfectly fine. If you get to a point where the client is too sensitive, sometimes it happens where the forehead is too sensitive, you could back down to, again, no EMS, and you're still going to get the benefits from the ultrasound. If you need some more slip, so if I feel I'm getting a little bit of drag, or it's you know, the gel is absorbing into the skin too much, by the time I get to the higher parts of the face here, I'm going to just add a little bit more product and continue working. So around the brows, I love to go just a little below the brow and again, work my way up to get a nice brow lift. Center. And this is a nice device for us SDs that just want a little pick-me-up. We don't have a lot of time to do a little 10-minute treatment once or twice a week for us. And that's a little refresher. So we look really good, tip-top shape for our clients as well. When I get to those little 11 lines there, I like to do a little extra zappy. Really work those down and kind of prepare the skin for the needle-free filler facial. Okay, if you have a little time left, you're going to go back and again, just do a little bit more sculpting until the device turns off at that 5-minute mark. And then you will repeat on the other side of the face. So just applied product to the left side of the face, the same way we did the right. And I'm going ahead and starting my device again. And I'm going to be working with level 2 here, which means the first level of the electromuscle stimulation. I'm going to be working, the device is very light, so it's very easy for me to use in my left hand, even though I'm not left-handed. I prefer to work with my right hand, and so I like to usually stand up and kind of work on the left side of the face with my right hand. You can also do the Master Pro over the lips to create a nice plumping of the lips as well. You just want to make sure you're putting enough product on the lips, and I would start with a lower level and work your way up. Many people are able to eventually tolerate the maximum level and they get some really nice plumping. And that's going to be also really helpful for people that have a lot of those fine lines and wrinkles right around the lip line as well. And another little tip for anybody that's wanting extra volume, the HOP Eye Repair Cream is now considered or called the Eye Lip Repair Cream. So it adds that collagen, the polylactic acid, and is used for the lips as well as the eye area. There really aren't many contraindications for this one. You're probably not going to be working with active acne clients doing the needle-free filler facial, but you definitely don't want to be doing ultrasound on somebody with active acne. But if you were going to be dealing with somebody with a little more sensitive skin or even rosacea, again, I probably would just do very minor EMS. And then you can just probably use, again, being the collagen gel has that azulene, it's really good for redness relief, really good for irritated skin. So again, a little bit of Master Pro is going to be fine. The LED and flashing lights are contraindicated for somebody with epilepsy. And then with all devices that produce electrical current in the body, with the exception of like our cold plasma devices that do not produce much electrical current at all, it's very minimal, that these devices, of course, if somebody had a defibrillator, a pacemaker, heart issues, you're going to avoid, products or devices that create that electrical current. So at the 5-minute mark, the device will turn off. Some people actually end up getting 2 devices and work, 5 minutes at the same time, holding and working 2 devices. And that is perfectly fine if that's something that you want to do and you feel like it helps you go a little faster. Time is money. And you want to be a little bit more balanced. So you're doing the same, pattern and same spots on each side of the face. You can totally do that. When I'm using the Master Pro, this is also another reason I like to do a client's before and after photos sitting up, because they will, again, in addition to plumping, they will get a nice lifting effect as well. A little tip for cleaning the Master Pro, you're not going to use alcohol on the surface. It's the only device that we really have that you're not going to be using alcohol. So I love to use my benzyl collatum wipes. Sometimes we call these like the OBG wipes that you get in those offices. So they're really great at sanitizing, but not using any alcohol. Barbicide does have a benzyl collatum spray as well. So I just prefer the wipes. Usually they're very handy, and I buy them in bulk on Amazon. So I usually buy them, I think a box is 100 and I buy them by 1,000 caseload. So next we're going to introduce you to the needle-free filler facial kit. This is a 15-pack kit, and it comes with the little instruction sheet, little instruction cards. It's going to come with 3 vials that contain enough for a five masks or 5 treatments, and that would include the face and the neck or the face and the décolleté. It comes with these little syringes, but again, these are not actual needle syringes. They're simply used to withdraw, take out product from the ampule itself. And I'll explain to you how much product we use at any given step. And then we also have the silicone brush that we use, and then little topper heads that I'm going to show you how to use because that's my preferred method. Now, you do not need to do any exfoliation with this treatment. However, I like to do a light exfoliation. My favorite light exfoliation is the Dr. Esty Skin Refining Peel, and it has a total of 8 different acids. It has 4 alpha hydroxy, a little bit of beta, and 3 polyhydroxy acids. I take a little jar, and you're going to use just about, probably about 6 pumps total for full face and neck. And then you can actually use your same dish or your brush where you used, where you had the collagen gel. Now, I happen to put the peel on top of any remnant that's left over from the Time Master Pro treatment because most of it's absorbed pretty well in here. And the peel is going to just help to penetrate that polylactic acid that's already on the skin a little bit more. So a little tip that it saves you time in removing. The goat milk peel is only left on the skin for a total of 1 to 2 minutes. 1 minute if a client has very sensitive skin. More normal skin, 2 minutes is plenty. So by the time I get this applied, I'm probably looking at just another minute or a little over a minute left. And it's pretty gentle overall. Clients usually can tolerate it very well. And then you can remove it with a warm towel. You can move it with some cool sponges, 4x4s, whatever your preference is. Typically when I have the exfoliant on, when I'm working with a client, usually an enzyme or, some kind of a treatment is on longer than a couple minutes. So then I might do a nice little scalp massage. But because this is only on for such a short period of time, I usually just kind of keep working a little bit with my brush. So I'm kind of doing a little bit of a facial massage with the brush as opposed to working on the scalp. Okay, so I like to use a warm towel, but I like to make it extra lukewarm when I'm removing a peel. So you still want it to be comfortable for the client, but again, not super hot that it's going to be an irritant when you're putting it on top of the peel. That's plenty. People ask a lot whether or not you can do any dermaplaning, any waxing, other exfoliation prior to this treatment, because the polylactic acid is really adhering to the hair and kind of wicking into the hair follicle. We prefer not to do any hair removal the day of. So if you wanted to do something like that, like a dermaplane, for example, or waxing, I would probably wait a few days and then do it after. You can also do other modalities. So if you wanted to do a little bit of microcurrent, a little bit of LED on the front end, galvanic, you just have a lot of flexibility. Again, our favorite is the Time Master Pro for its plumping and lifting effect. But if you have other modalities that you choose to use or want to use, you can definitely go ahead and do that. Okay, so we make sure that we've gotten off all of that goat milk peel. And we also want to make sure that the skin is really dry before we work with adding our polylactic acid hydrogen mask with the HOP needle-free filler facial treatment. Right now it's a little damp, but by the time we set up, we're going to have that be pretty dry. Okay, so again, I already have a pack pulled out in terms of I've started with an ampule. So when I show you this, that on the side of each ampule, you will see a series of lines, 5 lines. And so that's how much you're going to use in between the 2 lines is how much you're going to use for 1 full facial. So again, 1 ampule is going to be for 5 treatments. This will last up to a year open. You do not have to have this be refrigerated. The exception is the little growth factor, Pilleo growth factor ampules that you get. If you're going to be using them for microneedling or nano, you do have to keep those in the fridge once open, and they last for up to a week. But again, this is stable, shelf stable, so it's good to go. The actual kit itself is going to last for, a few years. So you're good to go if you have some of these hanging around. You'll notice that when you get your pack, each you will get 5 masks that come in one individual sleeve like this. So I'm going to go ahead and I'm going to pull out one set. If I was going to be doing a décolleté add-on or a hand add-on, I would take out another set, and the large fat wide piece I would use complete on the chest. And then I would also take the face mask and I can cut that into pieces and use it for 2 separate hand treatments. So just to keep in mind, I will keep a separate pack that I have in my treatment room that says pieces. So whenever I have extra pieces that are left over and I want to work on, just let's say an eye treatment or an upper lip treatment, you can then pull from your extra little pieces that are left over. So just make sure you indicate that, because those will come in handy. So when you open up your little mask here, and I will make sure you guys can see, there we go. You will see that you have 3 pieces, but I'm going to be cutting into several more pieces for ease of application. We're also going to be using again, our silicone brush that comes with the kit. Okay, so I'm going to put that aside. I've got our little ampule here, I'm going to put aside. And then you want to have your scissors so you can go ahead and cut these pieces. Now, good news is after the polylactic acid or the mask, the HOP Pilleo Mask was sort of upgraded. It's a little bit thicker for ease of application, also larger to accommodate larger faces, which is awesome. So I cut this first piece in half. This is going to be what I'm going to be using on my neck area, because I feel that it's kind of hard to hold taut and smooth and get into all the wrinkles when I'm doing one large piece. So I cut this in half. It's also really important, I feel, to use a towel that's not white, because these are clear and it's really hard to find them if you're working on a white towel. So prefer a darker towel when I'm working with the needle-free filler facial. Next, I'm going to be working with the face, the top part of the face, and I'm going to hold this vertical, and I am now going to cut through the eyes. So I'm basically cutting out the forehead piece, and I'm going to set that aside. And then the other piece, I'm going to basically be cutting out the nose. So let me show you that. We cut out the nose here. So I have one eye, and then I cut out the other eye or the full nose. So the nose piece, another eye piece. I set those aside. And then last but not least is our bottom piece to go on the lower part of the face. And I like to cut out the lip part, because that is something that I like to hold really taut and make sure that it's lining up with the people's faces, because whenever you work with sheet masks, they don't often line up well. People have different distances between their nose and their lips, and their mouth. So I cut out the lip piece here. Okay, so I'm going to set that aside. And then we're going to go ahead and start with our application. Now, like I mentioned, you can use the little syringe that comes in the kit to measure out, but I'm just going to, for purposes of demo, I'm going to show you how to use this topper, but I'm going to also give you the amounts that you use for each part of the face. So when you have the syringe, a full syringe you're going to pull out is going to be used for the forehead and temples. Another 1.5 syringes is going to be for the lower part of the face, and another 1.5 syringes is going to be for the neck area. So you're going to use 4.5 milliliters total for the full face and neck. That is going to be equivalent to you using about, the space between those 2 lines. Something good to know is usually when you get a brand new vial, there usually is enough in there for almost 6 treatments. So I almost never run out. I almost always have extra product left. So I'm going to start here. So I'm going to show you, and you're going to see how generous you can be without actually, feeling like you're going to run out. So I like to put a really nice size. So we're talking probably a good dime size amount right in the forehead there. And I'm going to start to gently just smooth across the surface of the skin. And our goal is not to penetrate the product, just gently to smooth like you're frosting a cake. So you're just going to lightly, apply it, make sure it's covering all the areas that you want to cover, kind of avoiding the hair area there. If you go over or near the brows, it's okay. Just remember that it might stick a little when you're removing. And when we get to that portion, I'll give you a little tip. So if you feel that it's absorbing quite a bit, it's probably because you've used your cold plasma, which increases product penetration significantly. So if you feel like you need a little bit more, go ahead. Just add probably, a pea size. And again, just make sure you see enough product sitting on the surface. Okay, so then we're going to go ahead and take that piece that was for my forehead. and you're going to have a textured side and a non-textured side. So one of the things that I usually love to do is I usually remove my gloves. It's like a little tip so that I can actually feel. I've done this enough that I know what I'm feeling right now. But usually if you feel like it's difficult to tell whether it's a textured side or non-textured side, at this point in the treatment, I would remove the gloves. So I'm going to be putting textured side down. I'm going to start with this little portion here that's going to go right in the 11 lines. And I'm going to start there, hold taut, and then I'm going to spread out, and I'm going to again pull taut, and I'm going to hold down for about 10 seconds. You're going to notice and feel the mask kind of melting into the skin, which is what you want before you lift your hands up. So perfect. Then I'm going to make sure I do that with the front end. I use my 2 fingers up here. So you can count to 8 or 10, and then you'll know when you can release. The same thing here, just putting in those last little pieces just so that they absorb in. If you have a little bit, and I'm going to show you in a second what this looks like, kind of hanging up over the hairline, totally okay. That actually helps for removal purposes. Any little additional bubble that you may see, if you didn't get it to be, completely smooth, do not worry, because we're going to be using the stem cell mist once I have this completely applied to kind of seal in everything, and it's going to create this really nice tight glass-like finish within the next 10 minutes of applying the mask. So next we're going to continue on. I'm going to do the right eye area. So a little tip, again, you're going to be working with the textured side down. Okay, so you're going to have it where this is going to go right underneath the eyelash. But one of the tips is, so you make sure that the product doesn't roll into the eye. I start with application further out on the cheek. So I'm going to start with a good, I would say about a pea size there. And then I'm going to first start blending down on the upper cheek to the temple area. And then gently, 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 I'm going to start working my way up to under the eye. And then getting as close to the lash line. But this way, if you put too much product right by, the eye area, it can tend to fall into the eye, to seep in, which you don't want. You just want to make the client more comfortable. So I always start further out and then gently kind of work my way in. Okay, and then make sure you cover the temple area there. When you're applying this piece, you are going to make sure, and if it helps you, I'm going to have, can you open your eye if you don't mind? If you ask the client to open their eye, you can actually make sure that you are covered better. And then you're going to go right up along the lash line and make sure this right piece here is finishing or starting actually right where the other piece finishes off. So you're going to hold taut, and it's going to just melt right away into the skin again. Okay, Barry, you can close. Okay, so that's perfect. So it's right up under her lash line. So this is going to really give nice volume to hollow under eye areas. Okay, we're going to do the same thing with the other eye. So I'm going to do about that pea size here, but again, I'm further out in the cheek if you noticed. So I'm way down here, sort of the middle of the cheek, working my way up to the temple area. And then little by little, making my way up to under the eye. Yep, thank you. And again, this will help with all those little fine lines and wrinkles under the eye. Then you're going to take your other eyepiece, again, textured side down, and it's going to go perfectly right underneath lash line. Show you here. Yep. Just holding taut. And about 10 seconds, it's going to seal and melt into the skin. You can close. Awesome. Okay. Next, we're going to work on the nose. And the nose area, I would say about a half a pea size. You really don't need a full pea size. And then I'm going to just gently start at the tip and work my way down again, so you avoid the potential for it to kind of seep into the eyes. Then we've got our little nose patch, again, textured side down. So we've got this little pointed piece here that's going to point down. Just hold taut. So my fingers are kind of gripping all around, and you'll notice it seals really well. So if you were trying to do that whole top piece in one piece, it would be really hard to hold taut and to get it sealed nicely around the nose and the eye area. Next, I'm going to do the upper lip. And I do a nice pea size right there because I really love to make sure that I have that upper lip, especially if they have a little bit more furrowing, fine lines on the upper lip. We want to make sure those are really held really filled in nicely. So here's our little piece here, again, textured side down. And this is what I really, really hold taut. So I start in the middle, I hold taut, keep it stretched out, and I push tight. And I want to make sure for about 10 seconds, I'm holding that taut, trying to smooth out any of those fine lines there and for that to absorb in, because that is a major problem for a lot of clients, especially if they were smokers or they love to use straws, you know, for different reasons, they'll get those furrow lines up there. Okay, now we've got our lower part of the face. And if you had a client with very, very tiny face, you could actually probably cut off these little pieces here, but I'm just going to go ahead and show you how to apply this full piece. And if there is overlap, it's totally cool because when you actually put on the stem cell mist, it's going to absorb in, they're going to just bond together. So I do one side of the face first. So I'm kind of putting a nice amount here, probably good nickel size amount, maybe a little bit more. And I'm starting with half of the chin, working around the jaw, and completing the full cheek here, along with this side area. And the reason I don't apply for the two sides of the face at the same time is because if you're working here and I applied to the other side, it'd be dripping down off her face. So once I've applied this one side of the face and blended it in, I'm now going to work with the other side of the face. Again, another 2 good drops here. And again, you can see that I'm being very generous and I'm not worried at all about running out of product. Again, you're going to have, I think more people are so worried that they end up putting on too little. But when you're first starting out, you might want to measure it out just so you can eyeball it and you can get a better idea of, you know, the amount that I'm talking about here. Okay, so starting at here, again, textured side down, I'm going to start right under the lip with this part. I'm going to hold taut, and then I'm going to pull taut. I'm holding taut, 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 tight, stretching. And then I'm going to hold like so, about 10 seconds. And you can see the little mask kind of curling up. So when it gets exposed to moisture, it starts to dissolve. This is why you want to make sure you don't have hands that are wet. And then I also do not spritz the mask before I apply because it will start breaking down. There's no need for that. I spritz after I've applied. And then I work in just having it seal around the jaw area. And then you can see there's overlap here, which is totally fine. So you just pat it in. And again, anything that's sticking up because it's extra from the overlap will kind of shrink wrap once I do the spritzing with the stem cell mist. So that is completely fine. Okay, now we're going to work on the neck area. And I'm going to be working one side of the neck. So nice big nickel size amount. And I'm going to bring it down half of the neck. And again, you can just see that it's just kind of lying. I'm just kind of really just kind of not really trying to penetrate it here, but just kind of spreading it out and making sure there's an even coat. And I do go right up to where that bottom piece cut off. Okay, so now what we're going to do, another little tip is I sometimes take this, and even though I'm going to lay it like so, sometimes I'll do a little snippet here just so it's easier to lay flat. I like to stand up when I'm doing the neck area. So I will start where the other one ends up on the jawline, and I will curve it around and just hold taut for 10 seconds here. Then I will work on that next piece down here. And then we fold over and do the other side here. And again, if it looks a little wrinkly or whatever, don't worry about it. This is actually a really good seal. When I do the spritzing, it's going to all shellac and shrink wrap on the skin, which is great. So next, we're going to do the other side of the face here. If you felt like you had a little extra material or a little extra mask and you missed a little area, I'm just showing you this little tip, but you can actually just even cut a little piece off if you're like, hey, I feel like I'm just missing a little part by the lip, for example, or something. So you're totally good. Okay, so again, textured side down. We're going to start, I'll have it turned here. Yep, I'm going to start on the side here, the jawline. And then you're going to hold down first. Just as long as you're holding taut and you commit for about 10 seconds, you'll feel it kind of absorb into the skin. And then we're going to continue here. And I'm going to just show you this. So I had cut out that little piece of mask. I really didn't need to cut it out, but I just wanted to show you. So here I have a little extra skin here. So you can take your little extra pieces and you just hold them down, face the textured side down, and they will absorb perfectly as well. So once I have the mask applied, I'm now going to do a very generous misting of the stem cell mist that comes with your initial starter kit as well. So it's called the Pilleo Stem Cell Mist, and I'm going to now protect the client's eyes. And I'm going to, again, heavily mist. And then I'm going to cover here, work around the sides. This eye. And then we make sure we get the nose. So again, it's a lot of mist. And then in about 10 minutes, this is going to shrink wrap really, really nicely and create this nice hardened film. And the client's going to feel that tightening as well. So you could let the client know that it should be tightening. I set my products aside then. And at this point, I would not do a head massage or a scalp massage simply because I don't want the client's face wrinkling up. I want this to seal really nicely, really smooth. So if you have a client that is a talker, and you will have some clients that like to talk, you're going to say, hey, now I'm going to have you just quiet, relax. We want to make sure this, fills in any fine lines and wrinkles. So you really don't want them making a lot of facial movement. So once I have this on for about 10 minutes, you're going to notice that it starts drying pretty well. So you could then come back and do the scalp massage. So this is needing to be left on for 30 minutes. If you're really in a pinch, you can use a fan. I like to sometimes take my leftover little pouch here and I can fan the skin. But as long as this gets really dry, I would say minimum 25 minutes, but we're really shooting for 30 minutes before we remove the mask. So a couple other options that you can do is you can put an LED panel, a red LED panel on top of the mask here. And the really benefit that is to help with drying, and a little bit it'll get through because this is a clear mask. While it's not ideal, and typically LED is best on clear, dry skin, you can still get a little benefit. So that is something that I do, and I don't charge extra for that application. And then I also have my O2 Derm oxygen treatment, and I will do a $50 add-on and have clients go under the oxygen dome for a good 20 minutes with this treatment. So now they're getting the benefits of oxygen, the anion therapy that they're inhaling as well. And so that's something that a lot of my clients choose to add on. You can also do a hand and arm massage. You can do a foot massage. So you have different points in this treatment where you can do that if you'd like to add that on as well. So again, the client's going to be sitting here relaxing for 30 minutes, and then we will pause, and then we'll come back and I'll show you how to remove the mask. Okay, once we've had this on for 30 minutes, it should be completely dry. You'll notice that we have a smoothing out of the fine lines and wrinkles. It was a nice shrink wrapping that occurred. So you'll notice that any type of bubbles that you initially had usually are smoothed out once you've done the application of the stem cell mist upon application of the mask initially. So for removal, I like to start with the forehead, work down, since that's what I started with first. If you feel like you have anything that was, any of the mask that was attached to the hairline, or a client with more lax skin, a little tip is you can go ahead and lightly mist the perimeter with the stem cell mist. It will soften the mask again for ease of removal. So we're gently going to remove. And again, the more lax, or if a client has a lot of vellus hair, you're going to notice that it's a little bit more irritating to the client. So then again, just gently spritzing is going to break some of this up and make it easier for removal. Always hold taut when removing it, so you're not like pulling the skin up. So it's not like you're waxing. So you always hold the skin taut. And you'll hear it. Sounds a little bit like waxing. It just means you've got a really good seal. Okay, so awesome. You can go ahead and take some before and after, or the after pictures now if you want. I usually wait until after I have my product applied, but before sunscreen, because the sunscreen is going to cause like a little whitening hue to the skin. So I want to make sure that any lightening effect that I get from this treatment as well, because it does a nice job of lightening and brightening the skin, that it's not going to be coming from the sunscreen itself. So we're going to take a generous amount of our Cavi serum, our Cavi PLLA. This is oxygenated with lots of polylactic acid and growth factors. And again, just as a reminder, the polylactic acid is the same ingredient that is in dissolvable sutures and in biostimulating fillers. So it helps to really activate one's own collagen production. So when this goes on, it has a really nice, unique delivery system where it bubbles up in the skin, as you can see this, and it's not hydrogen peroxide, so it looks like that, but it's actually oxygenating and creating this lovely decadent foam in the skin. And you're going to make sure you, like I said, put a generous amount on. I like to get near the eye area as well, the nose. And then after you let it bubble up for about 15, anywhere up to 45 seconds, depending on how fast you see it activating, I gently massage it very lightly, and you'll notice that it starts to refoam again as well. So I probably do this for a total of a minute with leaving this on before I completely massage it in. So again, you'll notice that it's foaming up again. And if you fan it just with a little air, you see that oxygenating effect. So you see a lot of that bubble action going. It's very tingly. So we've got a lot of that here. Okay, so that's helping to penetrate the polylactic acid in. So again, this is just going to be a lot of extra penetration to help with that stimulating collagen. You are going to let your client know not to wash their face for 12 hours, not to apply any water on the skin for 12 hours post-treatment. So you can notice again, there's still an extra foaming up here, rebubbling up. So I'm just going to gently massage that in again. And then when you notice that it starts to kind of die down a little bit, I'm going to do I've put an application of the Promoter Repair Moisturizer, and letting you guys know that this comes in two forms right now, two formulas. It comes in a normal dry and an oily acne. I typically use the normal dry. However, if you were out of it, you could definitely use your oily acne version. It also comes in a large back bar size, a 200 ml back bar size that some clients actually buy because they actually save close to 50% by buying the larger tube. So just letting you guys know that it comes in two sizes. Most of us do keep that for back bar purposes. Right now, I just have a small one, but the products are very generous. So when you buy a starter kit, the Cavi serum, the small 50 ml of the Promoter Repair Moisturizer, and the Stem Cell Mist will last you probably a good, I would say, anywhere close to 40, 50 different treatments. They do last quite a while. Okay, next I'm going to take my Promoter Repair Eye and Lip Cream that I told you guys about. I like to put a little bit on the top of my glove. I'm going to add a little to the eye area, top and bottom. And then I also am going to add some to the lip area because we want that plumping effect on the lips as well. So I do that with my pinky. And then I will go ahead and take my after photos. I'm going to pause here. I'm going to take my after photo, and then I will finish up with my application of my new HOP SPF 50 all mineral sunscreen. So with this treatment, I love to take my before and after photos two ways. One is I definitely like to have the client be sitting up or standing up for the before and afters just to see any lifting, overall plumping. It's really nice effect, preferably if their eyes are open. If not, you can also have the clients close their eyes if they don't want to be, seen in like some before or after photos publicly. And then also you can take a nice one of the client laying down. You can still see improvements under the eyes, the cheek area, for example. So now I'm going to apply a little of the all mineral SPF 50. This is good for Fitzpatrick's 1 through 5. So it's awesome. Very hydrating, very moisturizing. It contains also the polylactic acid, the growth factors, black fermented royal jelly, and that beautiful Damascus rose water that we love as our light scent. So if you tend to get a little white sheen, it's because you've either used too much, or in the case post this treatment, there is so much product on the skin right now. The client's skin is very, very hydrated. So there might be a little bit lighter glow post-treatment, but typically it does massage in very, very well. So just to give you a heads up, that is why we like to do the before/the after photos right after and prior to putting on the sunscreen, but right after we've put on those other products, just to prevent that extra sheen from popping up on our after photos. So there we go. And again, you're going to let your client know not to wash for the next 12 hours, not to get any water on the skin. And then you can talk to your client about the program, whether you're going to have them come in 2 weeks for a V-line facial, or you're going to have them come in for another needle-free filler facial, or if they're good enough, if you have younger clients and they get enough of a benefit and bang after one treatment, they might just start a maintenance program every 4 to 6 weeks with you. So that is the needle-free filler facial. With any questions, please feel free to reach out to Rachel and myself on Instagram at the SD Sisters or on Facebook at the SD Sisters. For more information, reach out to us. Thanks for joining us today.